Mr. President, are we in a quorum call?
We are.
I ask that that be vitiated.
Without objection.
Mr. President, I rise with many of my colleagues today to mark a new era for patients in this country. Last year, we decided that enough is enough, and we put an end to the sweetheart deal that let drug companies charge seniors on Medicare whatever they wanted for some of the most common, life-saving, and life-improving prescription meds on the market. Now the big pharma companies are trying to stop this legislation with absurd lawsuits. And I'll talk about that effort in a moment. But for now, let me say unequivocally, allowing Medicare to negotiate lower prices is a victory for seniors, a victory for taxpayers, a victory for patients and their families, a victory for America. Mr. President, thank you for your work on this. As the senator from Vermont, when you were the House member for Vermont, you led this bill in the House and I led it in the Senate. We worked together to allow for the negotiation of drugs. And finally, this bill has been passed into law as part of larger legislation. A number of our colleagues, including Senator Wyden of Oregon, have long been leaders on this issue. I think we all know this progress could not have come soon enough. We know that Americans pay the highest prices in the world for the same brand name prescription drugs. In fact, prescription drug prices in the U.S. are more than 250% higher than drug prices in other industrialized countries. And not only are prices sky high, we've all watched them get higher. As Senator Wyden has worked on this, as you, Mr. President, have worked on this, as Senator Schumer has worked on this, we have continued to battle, sadly, the other side when it comes to putting our provision into law that allows Medicare to negotiate better prices. Finally, we did it on our own. We did it on our own, but not really. We did it with the seniors of this country, with AARP at our side, with so many advocacy groups. Taxpayers should not have to foot the bill to have the money go into higher profits for companies that already are making much more than the average company on the stock exchange. Not only are we seeing high prices, but it literally makes it unaffordable for some patients. What good are treatments and cures if they go unused because they are unaffordable? The average price of the 25 brand name medications that Medicare spends the most on, 25 top blockbusters, has tripled, on average tripled, since the drugs hit the U.S. market. Think about it. We all believe in competition. We believe in capitalism. Well, if you allow for real competition and generics to get on, and you don't mess around and play around with the patent system and change this little thing so you get a longer patent, and you don't put into law a sweetheart deal that says Medicare can't negotiate any prices for 50 million seniors, which, by the way, affects everyone else, because when the biggest negotiating group in the country is locked out from the table, they're locked out of the room. It hurts everyone else as well for what the prices are. This change alone, when the administration just put the first 10 drugs on the negotiating table, 900, we have so many people involved and that will be affected by this, that we will save over $300 billion. That is a big, big deal. Not only are prices sky high, we know that the numbers only grow shocking as you learn about the people behind them and about the profit margins of the big drug companies. I'm thinking of Kerry and his wife who live in Cloquet, Minnesota, and both take Jardiance. This prescription drug costs them $750 each for just 1 month's supply, and that's on top of the cost of their other meds. I know of a 71-year-old Medicare beneficiary from Oak Grove, Minnesota, who also relies on Jardiance to control a heart issue. Last year, the drug cost her about $530 for a 90-day supply, roughly a sixth of her take-home pay from her job as a senior care resident. Another Minnesotan, a 67-year-old Medicare beneficiary from Glenville, paid roughly $750 total for a 90-day supply of Jardiance and Januvia, and stopped taking the drugs altogether due to the cost. And then there's another patient from Rochester, Minnesota, southern Minnesota, who was diagnosed with a rare form of blood cancer. She was relieved to find that she would be able to take an oral medication instead of invasive chemotherapy treatments. But it was going to cost $680 per month, nearly half of her monthly Social Security check. Her daughter applied for grants and figured out a way to make ends meet, but it just shouldn't be that hard. Those are just a few of the many Minnesotans who have had to tighten their belts to satisfy Big Pharma's greed. You'll hear the stories from Oregon, you hear the stories from every state in this country. In fact, Big Pharma makes almost, as I said, 3 times the average profit margin of other industries on the S&P 500 exchange. 3 times larger profit, on average, of other industries on the S&P stock market. And yet nearly 30% of Americans say they haven't taken their medications as prescribed due to cost. That's unacceptable. The presiding officer over in the House and I led these bills to get rid of that sweetheart deal. And yes, we got this into the Inflation Reduction Act, got it signed into law. A couple of years ago, Medicare announced the first 10 drugs selected for price negotiation, including, as I mentioned, Jardiance, which treats heart failure and diabetes, Januvia, another prescription for diabetes, Enbrel, a rheumatoid arthritis and psoriasis treatment, Xarelto, and Eliquis, medications to prevent blood clots taken by, together, those two, Eliquis, Xarelto, blood clots taken by 5 million Medicare beneficiaries. And I wanted to correct one statistic I used. It is up to 9 million Americans with Medicare Part D take the drugs that were selected. And they have spent, I said 300, they have spent $3.4 billion in out-of-pocket costs. Up to 9 million Americans with Medicare Part D take those 10 drugs, paying an average between $121 and $5,200 a month on out-of-pocket. $5,200 a month, how much is that per year? The pages can do the math. That is $60,000 on average per year. What does this mean for a senior on a fixed income? That relief is finally coming. For years, we toiled on this legislation. As a presiding officer in Senator Wyden, no, toiled on this legislation, but it was Joe Biden that finally got it over the finish line and signed it into law, giving Medicare the power to negotiate with drug companies to help bring the price of medications in the U.S. down. The law also, as we all know, has other provisions, $35 out-of-pocket monthly cap on insulin. This new policy has lowered the costs daily living for over 1.5 million Americans already. We now have drug companies that have voluntarily, for non-seniors, capped it. I predicted this would happen. Several of us did, because it's kind of hard to say, well, seniors get $35, but a 15-year-old has to pay $100 a month. So you're starting to see that change. The law also provides free recommended vaccines like shingles or pneumonia. That is going to help the average Minnesota senior save about $100. And then, of course, the legislation puts a $2,000 cap on out-of-pocket spending for Medicare beneficiaries starting in 2025. What happened? Lawsuits. Johnson & Johnson, let's name them. Johnson & Johnson has sued. I thought, well, we pass it, signed into law by the President of the United States. Anyone that knows Schoolhouse Rock knows, get both houses, sign a bill by the President, it's law. What do these guys do? They go out and they sue in court. Like, oh, we made a sweetheart deal 20 years ago and we want it back, so we're going to sue. Hire tons of lawyers, Johnson & Johnson, Merck, Bristol-Myers Squibb, Boehringer, Ingelheim, and Novartis, as well as the industry trade group, the Pharmaceutical Research and Manufacturers of America, better known as Pharma. They've all sued. We know that this effort is patently absurd. Government agencies negotiating on drug prices isn't novel or unprecedented. The VA has done it for years. End story, we persisted. after nearly $400 million was spent in lobbying in Congress, after every member of Congress had 3 lobbyists assigned to them. We still pass this bill. So, big surprise, they've gone to court, but we will win there too. Their legal argument is somewhat absurd that somehow this is a taking, when in fact it is their choice to participate in capitalism and provide these drugs and be part of our competition. It's not a taking. If they don't want to sell drugs to 50 million Americans, I guess that's up to them. These first 10 drugs are just the beginning. We must go then to the next 15, the next 15, the next 20. That's how the law works. And at the same time, take on these patent cases that Senator Grassley and I have done. Senator Cornyn, Senator Blumenthal, others in Judiciary are leading bills to take on the sham petitions, take on the product hopping, and take on all the bad stuff that keeps competitors off the market. But in the end, this should be a celebration. This has finally begun, and they're not going to end the celebration for 50 million seniors with all their lawyers, no matter how many they hire and no matter how many they bring to the courthouse. With that, Mr. President, I yield to my wonderful colleagues. Thank you.